Did you know that you can reduce your blood pressure naturally? High blood pressure, also known as hypertension, the silent killer, affects many more people than you think. In fact, 1.28 billion people worldwide are currently living with hypertension. Now that is a staggering amount of people. This is double the number of people affected in 1990, according to the WHO. So, if you have been diagnosed with high blood pressure, well, you are not alone. In today's world, with changes in our lifestyle and eating habits, many chronic conditions are on the rise, including high blood pressure. Some of you might ask, what is even blood pressure? Well, blood pressure simply means the force with which blood flows from our heart through our blood vessels. When this pressure is high, this puts a strain on the blood vessels and can cause problems such as stroke and heart disease if left untreated. Think of it like a pipe flowing with water. When the pressure becomes too high, it can lead to disaster. What if I told you that there is a type of tea that can help you lower your blood pressure fast? Maybe you'll swap that cup of coffee for this special tea instead. Well, stay tuned as we will be discussing this and much more. Today we will talk about the top 7 ways to reduce your blood pressure naturally without the use of medications. So, grab a seat, hit that subscribe button, and let's dive in. Note that all the information in this video has been fact-checked, reviewed, and verified by medical professionals. Number 1. Reduce salt intake. Meals are much tastier with salt, so it might be tempting to use the salt shaker at the dinner table. This, however, isn't a very good move, as too much salt can cause elevated blood pressure. How does salt raise blood pressure, you may be wondering? Well, salt contains sodium, and sodium naturally draws water. Hence, excess salt raises your blood pressure by attracting more water into your bloodstream, which increases the volume and pressure of blood flowing through your blood vessels. In fact, the daily recommended salt intake for an adult is 6 grams, which is equal to 1 level teaspoon a day. The average adult, however, consumes 8.65 grams of salt a day. This is because a lot of salt is hidden in foods that don't even taste salty, foods such as bread and breakfast cereals. How then can you reduce your salt intake? Keep an eye out on food labels, as a lot of canned and processed foods contain salt. Try to cook your food from scratch using fresh ingredients and swapping out the salt for herbs, spices, and even lemon juice to give your food that flavor you crave. Remember, moderation is key, so go easy on the salt shaker. Number 2. Green tea. Everything is better when we go green, even your tea. Did you know that green tea can be a powerful ally in the battle against high blood pressure? Green tea contains powerful antioxidants that help our bodies combat free radicals. It also contains substances called catechins. These substances help our blood vessels to relax and expand, which eases the flow of blood inside these blood vessels, therefore lowering your blood pressure. A study carried out in February 2020 involving 1,697 people found that green tea or green tea extract significantly lowered systolic and diastolic blood pressure. So, to get your blood pressure numbers on the green side, swap out that cup of coffee for some green tea. Number 3. Rest. In today's world where we live at a very fast pace, we hardly get enough time to rest properly. Sleep helps our bodies to heal and rejuvenate. During sleep, your heart rate naturally slows down and your blood pressure decreases. This break allows your heart and blood vessels to rest and prepare for the next day's tasks. A study published in November 2023 found that people who slept less than 7 hours a day were more likely to develop hypertension than people who slept 7 to 9 hours daily. This suggests that the sweet spot for adequate sleep is between 7 to 9 hours of sleep daily. This means that a good night's sleep can be the key to reducing your blood pressure. Did you know that in addition to rest, there are some techniques that, if practiced, can be potent in reducing blood pressure? If not, then stay tuned as we will learn about them today. If you are enjoying this video so far, don't forget to like and subscribe so you can keep getting valuable life-changing information regularly. Number 4. Try meditation. As we go about our daily lives, we encounter immense amounts of stress, and sometimes we need to distress. This is where meditation comes into play. When our bodies are under a lot of stress, our adrenal glands, which are located just above the kidneys, produce a stress hormone called cortisol. This hormone leads to a rise in your blood pressure. This is usually temporary, however, when we are constantly under a lot of stress. This can lead to constant elevation of your blood pressure, which is harmful to your health. Meditation and breathing exercises can help us distress and escape our stressful lives by teaching us to focus and take our attention away from the stresses of life. Meditation, along with deep breathing, slows your heart rate and promotes relaxation, which in turn reduces blood pressure. It is such a useful tool that a professor at the Harvard Medical School recommends practicing meditation for 10 to 20 minutes twice a day. Here's how to do it. Sit in a quiet place with your eyes closed. Relax your muscles and silently repeat a word, phrase, sound, or short prayer of your choosing over and over. When stray thoughts interfere, as they will, let them come and go and return to your word, phrase, or sound. Number 5. Exercise. Exercise is a natural remedy to keep your blood pressure under control. Regular physical activity makes your heart stronger. A stronger heart can pump more blood with less effort. If your heart is working less to pump blood, this reduces the strain on your heart and blood vessels, reducing your blood pressure. Exercise doesn't always have to be hard. It can come in different forms, including a relaxing swim, a bicycle ride down the countryside, or even a nice dancing session. How much exercise is enough? Research suggests that exercising 30 to 60 minutes, 5 days a week, can lower blood pressure by 3 to 6 millimeters of mercury. The American Heart Association recommends that we get at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity, or a combination of both, preferably spread throughout the week. This means just 30 minutes of exercise daily should be enough. You don't have to go hard from the beginning. You can start slow and gradually increase your pace. Remember, small steps can lead to big changes. Also, choose activities you enjoy, as this will make the experience more pleasurable and feel less like a chore, but more like a treat. If you, however, suffer with heart conditions, speak to your doctor before embarking on new exercise regimens. Number 6. Maintain a healthy weight. Maintaining a healthy weight is essential for maintaining a healthy blood pressure. For as long as man has lived, weight has been a very touchy subject, however. When it comes to your blood pressure, it is a topic that must be touched upon. Extra pounds mean your heart has to work harder to pump blood. This puts pressure on your arteries and increases your risk of hypertension. It is not all bad news, as even losing a small amount of weight can make a huge difference. It has been found that even losing 1 kilogram of body weight, which is about 2.2 pounds, can lead to a decrease in blood pressure by 1 millimeter of mercury. You don't have to go all out when trying to lose weight. Taking small steps like swapping out snacks and processed foods for fruits and vegetables, or taking the stairs instead of elevators, can lead to big results over time. Remember, it isn't just about losing weight. It is about maintaining a healthy weight. So shed those extra pounds to shed those numbers on the BP machine. Number 7. Alcohol. Drinking alcohol in excess has been shown to increase blood pressure. No level of alcohol is considered safe, however. We all love to have a drink on a night out to lighten the mood. If you must drink, moderation is key. In the UK, the government recommendation is not to drink more than 14 units of alcohol per week for both men and women, however. In the USA, it is recommended not to drink more than 1 drink per day for women and 2 drinks per day for men. It can be quite difficult to cut down on alcohol intake, but here are some helpful tips when trying to cut down alcohol use. Check the label. Many drinks labels now tell you how many units they contain and how many calories. Make your drinks last longer. Add mixers or water. Alternate with soft drinks. Drink a soft drink or a glass of water between alcoholic drinks. Avoid bar snacks like crisps and peanuts. The added salt will make you want to drink more and will raise your blood pressure. Have alcohol-free days, spread your drinks out throughout the week, and have days off. And remember, don't drink and drive. This wraps up our top 7 tips on how to lower blood pressure naturally without having to use medications. Remember, before you make any drastic changes to your lifestyle, always speak to your medical professional. And do not stop taking medications prescribed by your healthcare provider without first consulting them. Don't hesitate to tell us if you've learned any new tricks to help lower your blood pressure. Don't forget to like and subscribe. Thanks for watching.